Hi, this is Japina from Japina Method Lymphatics, and I thought I would just give you guys a quick tip on garments and why we use garments. There are 5 top reasons that we use garments. We firstly want to have the right fit, that the garment is either not too tight or not too loose. If a garment is too loose, it will rub against our wounds and it can cause them to be irritated. If it's too tight, it can cause too much pressure, not allowing enough circulation and oxygen. Your either your lymphatic drainage therapist who knows how to fit a garment can help you with that, or your doctor your surgeon will help you fit that garment, and the size of that garment will change from your day of your surgery. It will be a lot tighter, and then it will start to go down, and once it becomes too loose, you need to be resized. So you want to make sure your garment's not too big or too small. And then we also use firm padding, like a lipo-firm, to help fill in the gaps so we have a nice consistent pressure so that your garment can create a nice smooth glide on your tissue. The second reason we want to have in a garment is we want the correct design. We do not want Spanx for a first stage 1 garment. Stage 1 is just got out of surgery. You'll probably leave the surgery room with your garment on. A lot of the garments that are used, the top brand I see internationally is the Morena brand, which is great. There's some other ones like Design Veronique, a couple others, but those are the 2 I am most familiar with. Design Veronique is a lot stiffer and more of a flat knit, and Morena is more of a sort of circular. When I mean circular, it's a more sort of bendable, softer fabric. I think they're great. I personally like to have one that's sort of more of a stiffer knit and one that's a more gentle knit, so that you can have a combination. It is going to be more expensive to have 2 garments, but this is something you are investing in your health, so something to consider. The third thing is you want to make sure you have the correct fabric, and that you have the right kind of pressure, like I just mentioned, that your garment pressure is consistent throughout your garment. If you have a tummy tuck, you want a garment to go, over the lower body area in like below the inguinal, so that you can have a good coverage there. So yes, the amount of pressure, we already went over that. The fabric type that you're using, we talked about that, whether it's a stiff knit or a softer knit. And then your wearing schedule. So how often you're going to be wearing your garment, pretty much 24/7 for 3 to 6 months. So we do want to make sure that is the right fit for you. Usually, there's time in between washing your garment, which is why it's recommended to have 2 garments. It seems like a long time, but really if you consider that your garment is keeping all the layers of tissue stitched together so that the fluid and all of those new, things inside of your body are having just like I think of it like lasagna, like you have different layers inside the tissue that need to stay moisturized and sort of working together. If you start to have bubbles inside that sort of lasagna, then that's where you get like a space and all the fluid will want to fill in, and then you're at high risk of seroma. So it does make sense when you think about it. And that is another good reason to have a lymphatic drainage therapist for your entire recovery, which could be 3 to 12 weeks for a lot of like the drainage work and the compression therapy, so that we can kind of see how are you doing, how's your garment doing. That is something we're going to check on every time. So I hope this helps you take some tips for surgery patients. Leave me a comment. Let me know if you want to learn about anything else. I am going to continue to blog. I'm dedicated to 100 days of posting on this YouTube channel. So I have a lot of knowledge and I just want to share it with you. But comment, get interactive with me. I want to hear what you use for your garmenting, what worked for you, for what kind of surgery did you have? Was it a tummy tuck? Was it a full body lift? I have treated every single kind of surgery. So if you have a question, please shoot it down below and I will give you an answer.